Good morning, everybody. Today we will discuss together the anti-chemotherapeutic agents or anti-neoplastic agents. Firstly, I'd like to introduce myself. My name is Alyaa Elsergany. I'm a lecturer of medical oncology and adult bone marrow transplantations, faculty of medicine, Mansoura University. Firstly, I'd like to define what are the anti-neoplastic agents. These are chemotherapeutic agents used for the treatment of cancers regardless the aim of treatment, whether the aim of my treatment for this patient was to achieve complete response or cure, or whether I'd like to palliate symptoms and signs of these cancers in these patients. When I explaining how can I treat a patient diagnosed to have cancers, basically there are three major modalities of treatment like surgery, radiotherapy, and chemotherapy. I'll mention today what are the rules of chemotherapy for treatment of cancer patients. While treating patients diagnosed to have cancers, it was found that some cancers where chemotherapy works very well, as these cancer cells are very sensitive to the effect of chemotherapy, like childhood leukemia, lymphoblastoma, osteosarcoma, some cases of testicular cancers, Hodgkin disease, some types of lymphomas, especially the indolent lymphomas, of course not aggressive lymphomas, and some patients diagnosed to have an early breast cancers. On the other hand, there are different types of cancers that cannot be treated largely with a certain modality or a single modality of treatment, whether it was a surgery alone or chemotherapy alone or radiotherapy. So for proper treatment of these types of cancers, multi-modality approach will act well. Some cases of colonic cancers patients, lung cancer, late stages of breast cancers, and pancreatic carcinoma. So, when I mentioned before that the chemotherapeutic agents are a chemotherapy or the chemical substance entering in the body, of course, after achieving a beneficial effect, which is the treatment or the cure, on the other hand, it will be on the cost of the toxicities caused by the effect of these chemotherapeutic agents on the normal cells of the body, as these are the blind chemotherapy or blind chemical substance entering into the body, affecting the normal cells like affecting the abnormal or the malignant cells. The effect of chemotherapy on the normal cells is called toxicity, while the effect of chemotherapy or the chemical substance on the malignant cells, it will be defined as toxicity or problems associated with cancer's chemotherapy. When I discussing what are the problems facing a medical oncologist when treating cancer patients, number one, of course, is the resistance to chemotherapy. When treating a patient with certain type of chemotherapy or certain protocol of a chemotherapy, and this patient's firstly performing well and have a marvelous response, after a while, these patients will explain reducing or decreasing the response rate for this type of treatment despite the obvious response noted before. While explaining what are the causes of resistance to chemotherapy, it was found that this resistance may be due to several mechanisms, like decreasing the amount of the drug uptake by the cancer cells as occurring when using the methotrexate. On the other hand, increasing the amount of drug removed by the cancer cells, which is called the drug efflux, caused by presence or development of co-transporter like P-glycoproteins, which is responsible for removing the drugs rapidly from the cancer cells, as occurring in different chemotherapeutic regimens containing vinblastine, doxorubicin, pleomycin, etoposide, together with decreasing or alteration in the targeting molecule sensitivity, like occurring of mutations or changing structures of the molecules responsible for response for these cancer chemotherapeutic agents while occurring in the methotrexate and mercaptopurines used in treatment of patients with acute leukemias, and of course doxorubicin, which is used in different varieties of treating cancer patients. Lastly, increasing the DNA repairing ability of the cells via increased expression of the DNA repairing enzymes. This is responsible for, after destroying the malignant cells by the cancer chemotherapeutic agents, these DNA repairing enzymes again repairing the cells, so the cells regaining its function ability again, and this is lead to resistance, and of course this is a dangerous sign of drug resistance and aggressiveness of cancers. This is occurring mostly while using alkylating agents. Number two, as we mentioned before, the toxicity of anti-neoplastic agents, and this is due to the effect of chemotherapeutic agents on the normal cells while destroying the abnormal cells or the malignant cells. And this is of course will be manifested by alopecia if the toxicity affecting the hair follicles, while if the chemotherapeutic agents affecting the normal stem cell presence in the bone marrow, it will lead to severe myelosuppressions, and this is a great problem for patients after chemotherapy. Or it may affect the GIT and lead to mucosal cell injury, leading to emesis and nausea and vomiting, which is a great problem found in almost always all patients receiving chemotherapy. And of course, low blood elements or low blood counts. This is due to effect on the bone marrow, as we mentioned before. Another great problems found in some patients receiving anti-neoplastic agents is the development of second cancers. I have a patient diagnosed to have a certain type of cancers, and after treating this patient, and the patient achieved the cure rate high for this cancer, later while these patients will develop another cancer due to one of the chemical substances used in the treatment of the initial cancer patients. Like when using alkylating agents on the long run, it will lead to myelodysplastic syndromes and leukemia, and the patients receiving chest irradiations will develop the breast cancers, and patients diagnosed with lymphoma when having neck radiation or radiotherapy on the neck, later in life they will develop thyroid cancers. And on my practice journey for about 11 years, I found a lot of patients were previously diagnosed to have breast cancers, and after achieving a cure rate and the patient completely cured from breast cancers, later in life I found that while following the patient, reducing the blood elements, the patient explaining leukopenia, thrombocytopenia and anemia. And when performing a bone marrow aspirate evaluation for these patients, unfortunately this patient was diagnosed to have a leukemia. I have found mostly about 9 patients through my 11 years journey for treating cancer patients. So let's discuss together how these chemotherapeutic agents working or performing for destroying the cancer cells. It was found that these cancer chemotherapeutic agents acting mainly on the cell cycle to affect the mitosis or affect the reproduction of the normal cells. So firstly, I'd like to discuss with you what is meant by the cell cycle. This is a cell cycle, or the cycle performed by the cells, either normal cells or malignant cells, to be divided into 2 daughter cells, which is called mitosis. This is called the regeneration ability of the cells. The scientists classifying or dividing the cell cycle to be a G0 phase, which are the quiescence phase, then the cell transported to the G1 phase, in which is cells starting to increasing in size and starting to form the enzymes needing for the DNA synthesis. And when discussing the DNA synthesis, I should mention the S phase, which is the phase for synthesis of the DNA. Then, after finishing the S phase or the DNA synthesis phase, the cell entering the G2 phase for duplications of the protein, and lastly, the M phase, which is the mitosis phase, which is responsible for the production of 2 daughter cells. So, when classifying the mechanisms of action of cancer chemotherapeutic agents, it was found that certain chemotherapeutic agents acting only in certain phases of the cell cycle, and those they are called phase-specific agents, like vinca alkaloids, which acting commonly on the M phase, or antimetabolite agents. And another category of cancer chemotherapeutic agent acting only on certain phase of cell cycle, which is called cell cycle specific phase, like mitomycin and doxorubicin. And there are certain types of chemotherapy acting on the cell cycle wherever the stage or wherever the phase of the cycle, and of course this is called the cell cycle non-specific agents. So another classifications to the cancer chemotherapeutic agents, I will or to antineoplastic agents for precisely the definition. They are cytotoxic drugs like alkylating agents, antimetabolites, plant alkaloid, or miscellaneous agents. Of course, I have certain antineoplastic agents acting by another mechanism of action, like hormonal agents which act on hormonal receptor, like treating patients with hormonal receptor positive breast cancers, and immunomodulatory agents and immunosuppressive agents. These are agents acting for rearrangement or manipulations of the immune system and the immunomodulatory microenvironment, and the development of the new era of immunotherapy in patients with cancers. And another agents, immune stimulant agents like interferons and interleukins, which are used greatly for treating patients with malignant melanoma. And lastly, this is a simplified diagram classifying the chemotherapeutic agents according to their mechanisms of action and the effect of the DNA synthesis and DNA repair. And thank you.